Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees. Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, listen up here, man. I don't even know where to start except for this has been a long day. So today we found out about further restrictions in Ontario, and a lot of us that have had a bit of a platform have been advocating for some more targeted approaches and really using the data to drive our decisions when it comes to schools, when it comes to outdoor gatherings or activities, when it comes to reducing the spread especially when it comes to essential workers. That was a clear source of major spread. So I had my lovely colleague, Dr. Tom Psarras, I feel like this is about your fourth show, my friend. What do you think? Are we up to
lost count now?
Oh, lost count.
As long as people don't get tired, that's all right. This is my therapy.
Oh my God! By the way, Phil says you're looking good. Phil Hazard.
Oh,
yeah, hazmat suit.
One of my favorite docs.
He's so slick.
I always smile when I
know, when he comes in the room, he's just just kind of sneaks in there. Anyway, Tom was reached out to me today, actually, after the announcements, and I said, we gotta voice some stuff right now. And so maybe, Tom, why don't we start with what were your thoughts when you heard the Ford announcements, reducing outdoor activities, for example? What was going through your mind, Grapes?
So here's what's going through my mind, Grapes. One of the things that I think a lot of people. So let me preface all this by saying, I just got off a week of ICU. I'm just gonna have two or 3 days off, and then I'm back in the thick of things probably for another 3 weeks straight. So this is time I'd love to be spending with my kids, but I think there's a certain kind of approach that we have to talk about. So number one, I'm an ICU physician. I'm not an epidemiologist. I'm not a public health official, but I do think that we see things in the ICU that allow us to have an approach as to and a say. I think as to, our healthcare system and how things unravel. So I don't pretend to be the premier. I don't know the stresses of being a premier and everything that can hit you. But there's one thing in this, we're obviously facing a third wave that's going to be from the perspective of an ICU perspective, and management of healthcare beds is going to be very, very, very difficult, and healthcare resources. That is unprecedentedly true, and we're both going to be in the fight. I always like to take a helicopter view of things because I don't think a lot of other things are mentioned, and I think we can. You've dove into that amazingly, because I don't think there's stats for that, and it is what it is, right? I feel a sense of frustration sometimes when I don't hear that being talked about in the mainstream media.
What specifically you talk?
Joblessness, the effect of, people talk about the economy, and I understand that. But I've had close friends who are devastated by the economy. House prices are going up. Yes. Ottawa is a very interesting market but I think that people's lives have been overturned. That doesn't take away anything that you and I see. And, pandemics are tough. Children, again, data backs this up. It's just not anecdotal experience, but I know people have reached out to you. People have reached out to me saying, my children are at their breaking point. And, the reality is that, I think none of us have the perfect answer to all of this, but not addressing those issues and not talking about those issues, I think is also not right from my perspective as a physician. Mm-hmm. I've seen a lot of people that I know with children whose children are legitimately suffering. And I don't think we as adults appreciate the effect that socialization has on the developmental aspect of children. And that is one thing that I never see. I see epidemiologists talking about whether or not, the R is less than greater than 1 in children themselves and transmission in children and things like that. But that doesn't talk about the vital part, right? Of, for teens, for example, socialization in some sort of safe manner is very, very, very important for them.
Yep.
It is truly important for them. CHEO, Toronto sick kids, they wouldn't be putting out statements like they have if they didn't really feel that this was an issue. And we have to be able to talk about those issues even in the midst of a pandemic, because everything in life, we're afraid to use the term trade-offs. We're not using trade-offs lightly. We're talking about side effects. It's like when I'm giving a medication by my physician, there's a trade-off. There's a possibility that something might happen to me, but I make an educated decision. And we're in a really tough situation right now, partly because I don't think collectively as a society, we've actually thought about those trade-offs well and thought about data-driven things. Mm-hmm. For example, outdoors. So that's the one thing that I think has frustrated me as a physician. What I see is essential workers largely in my ICU, and essential workers, unfortunately, who have to come home and they have to breathe, right? They have to breathe. And so they give it to other people in their household, and then it spreads. And that's who I've seen in my ICU, So I think what bothers me to a certain degree is that we're at this point now, and we can dissect it, partly because we looked for easy solutions to difficult problems. And I think everybody thought they had a right answer. And I don't think people understood how difficult this problem really was. Mm-hmm. And I don't think we openly talked about things that are tough.
Can I say something there, Tom? Do you know where I see a lot of the problem was because at least initially, the non-lockdown speak was taboo. I think it really limited our views. Like we wanted to lock down and look at nothing else except for our COVID numbers, and so talking about how it's affecting our kids, what's it's doing for mental health, what's it's doing for excess deaths, that's not kosher right now. And then more and more, we seem to have this groupthink. It was like this, everything had to be dichotomized. Either you were pro lockdown or not. You couldn't look at it. There was no invitation for nuance. And it wasn't, and the thing that drove me nuts is if you took that data-driven approach in terms of our where COVID was spreading, it was very clear.
Absolutely.
From the beginning, so a lot of things were clear. One was the risk factors for sure, like, right. Diabetes, obesity, hypertension. But where is it going? Long-term care. We knew we missed a boat there. Eventually, we dealt with it with vaccines. But the essential work.
Yeah, thankfully, it's been a remarkable
game changer, life changer. But then you look at the essential worker piece, for example. Clear multi-generational homes, racialized communities, high rises, and we did nothing until the vaccines to address that. We didn't do anything about it. And then you look at places like Toronto, the GTA, Scarborough, and all that. They've been in lockdown since November, some form of lockdown.
Absolutely.
And they're still in trouble because we never got to the source. Deal with the source.
Right. But the question we have to ask ourselves is, why haven't we dealt with the source? Right. I think, again, I'm not an epidemiologist, but when I read epidemiology literature, as far as this pandemic is concerned, what I see over and over and over again is over dispersion of basically, mass outbreaks. Where do they happen? Manufacturing, meat packing plants, people who have to go to work in closed, confined areas for long periods of time, who then go back to multi-generational households or households that don't have a 3,000 square foot, architectural plan around them.
Yeah.
That is, we all knew that was caused. I mean, so many people have outlined the data. And part of it, and I have to put the media on here because, we don't hear, we've only just started hearing that. Like I'm not talking about, but we've only just had the media start talking about this in the last couple of months.
Absolutely. Not even the last couple of months, the last couple of weeks, actually.
Okay. And, the problem is a lot of people have been speaking about that. And a lot of epidemiologists have been talking about how things are spreading. I mean, if you look at who's getting sick, there's great graphs to show in Toronto, income, marginalized status, where you live, what postal code you live. I mean, that's clear. It's not the person who's working from home on Zoom who goes to the groceries and flips her trunk. Okay. It's just not, and no offense to that person, that person's, going on instinct, a survival instinct. But the reality is that's not where you go for the problem. And what I liken that to is the pandemic theater around cleaning surfaces and hard cleaning and deep cleaning and things like that, right? Mm-hmm. We know there's been, how many hundreds of papers written on even editorials and just saying, you know what, this thing isn't driven like a gastro. And yet
it's not
everywhere you
surfaces.
see, today I was in a fantastic business. I'm not going to say their name, because I had it was for medical care for my son, and like a phenomenal business, but had to get his eyes checked basically, right? And everywhere is kind of, this place has been cleaned, it's safe. This place has been cleaned, it's safe, right?
Theater.
But that's all theater.
Yeah.
Right? It makes people feel good, but it's an enveloped virus that we know more and more has, people are going to freak out when I say airborne, but we have to aerosol, close contact, but it's through the air. Okay. It doesn't mean that I'm going to infect you 50 feet away, with one drop. And hopefully we can talk about that. But that is the problem. It's you breathing it in. Okay. Yeah. And we've talked about that a million times. And everywhere I go, there's signs. The other day I was walking around, just because I need to do something. I was taking I'm a bit of a hobby photographer, and I saw everywhere signs in, copper, put copper here, put copper there. This will disinfect this. Do you know what I mean? Because copper doesn't grow viruses. It was all over. It was on bus stops. And the problem is pandemic theater, right, appeases people's kind of panic or anxiety about things. But then it doesn't deal with the problem.
It's a distraction.
And you and I have, look, again, I've never said this before, and I don't mind saying this, right? Okay. I've never said this before, but I'm going to say it now. You're going to be like, Tom, what are you doing? But I was diagnosed with OCD when I was 10 years old. Okay. I've never come out publicly with that. Okay. But I understand what an anxiety disorder like OCD does to a human brain. So I look at this and I can dissect this like nobody's business, because I've gone through it as an individual, right? The problem is that people are looking for answers. And the problem is that when you're anxious about something, your brain is hypervigilant. and then it turns everything into a threat. And your risk assessment goes down the tubes. You have no capability of assessing risk because everything slowly starts making you more. And as a teenager, I felt that makes you more and more scared, So you have to, whatever. Okay. But your ability to assess risk, whether it's getting on a plane, whether it's walking across the street, whether it's doing a public speech, it is vastly overstated. And the problem with that is you look for simple answers. And this is what's happening a lot in our society right now. We're looking for, has this place been disinfected? Well, it doesn't matter if you go to a large grocery store with 2,000 people in it and everything is disinfected. The reality is if there's 50 people in there breathing, right? That's how it spreads. Mm-hmm. Okay. So we have to get away from, we have to understand how the human mind works. And we also understand how society is working right now. I think there's a lot of very anxious people out there and we're looking, and I don't fault them for this, but we're looking for simple answers. Mm-hmm. And the problem is that we're hyper vigilant as a society right now for everything. And that creates binary arguments. Mm. If you basically say, if I'm suffering from a panic disorder, an anxiety disorder, and I walk into a situation and I think that is a threat to my existence, what do I do in that situation? I fight or flee, right? Mm. If you are telling me something that I don't want to hear, that's it. Put that on top of social media and you lose nuance.
Yeah.
We had nuance when something wasn't a personal threat. When something becomes a personal threat, when it's about your children's health, which, by the way, again, a lot of that was theater, right? Mm-hmm. It wasn't about children's health for the most part. And and you and I mean, look, Sick Kids has agreed with that statement, right? I mean, every respectable epidemiologist has agreed with that statement. It's about adults' health, but we have to be able to speak in those terms so that we know what the trade-offs are.
Yeah.
Because we don't have an unlimited amount of resources of money. We don't have an unlimited resources of time. If the incubation period of this was 4 years, or if, I was contagious for 5 months, would we have 5-month lockdowns? No. So we just have to I don't have the answers to everything, but we're not talking in nuance. We're not talking, and I'm not talking about today. Yes. Okay. Lockdowns, maybe I'm talking about since the beginning of this. After 3 or 4 months, we had a lot of data, but we stopped talking. What we started doing was becoming binary.
Yeah.
And you were shut down by people that shouldn't have shut you. You know what I mean? Like other people started talking about things and we shouldn't have done that. We should have just had a discussion. And even today on Twitter, I see scientists and doctors going at it. Yeah. And it drives me crazy.
Yeah. Number one, knowing you, I might get a little emotional thinking about it, but for you to bring up your battle with OCD on a stage like this, you ain't playing. This is you know no. What I mean? Like, the gloves are off. So I just want to appreciate you, being as open as you have been.
Look, Kwad, I just want to say this, okay? Because there's a lot of other people who've suffered with mental illness. I'm a pretty tough guy. Yeah. I've seen a lot. I hopefully I've done a lot. I think I've helped a lot of people. But in my teens, I suffered through it. And I understand what people are going through when it comes to anxiety, when it comes to this, because just picture this for a second. As a physician in the intensive care unit, I have OCD during a once in a century pandemic. Yeah. And I'm doing extra call.
Yeah.
And I had no vaccine. And other than a week of getting used to it, I was in every patient's room doing everything.
Intubating, lining, doing everything. Physical So if people out there want to say, walk your lane, I'm walking in that lane and this is my lane. It is your motherfucking lane. I'm sorry.
But this is my lane. I understand what people are going through and nobody can tell me you don't get it. No, that I get it.
Yeah.
I don't want to get into specifics, but I get it. I'm an ICU physician. I have OCD. I battled with it for years when I was younger. It never goes away 100%. And I got COVID all over my hands and And I've had to use my cognitive behavioral assessment to say, it's all right. Your risk is 1 to 3 in 10,000 of dying. I told you about the time where, on top of that, where I walked with my daughter, and I told my daughter, I'm not making this up. Right? We were here, right outside here, and I said to her, Daddy's got to go to work. I don't mean this to sound whatever. I have enough money if I don't want to go to work again, and I'll be okay. Mm-hmm. But I didn't say that to her, obviously, like that. But what I meant was, I have a thing to do. Do you want me to go to work? There is a small chance, because we didn't know that about that time, that Daddy might not come home. I've seen it in Italy. That was early on, April, whatever. And she looked at me, she was 13 at the time, and she said, I want you to go to work. You have a job to do. So I get it. I get when people have to make decisions. I get when teachers have to make decisions. I get when doctors have to make decisions.
No.
So now let's talk. The gloves are off, because let's talk.
Yeah, no, it's absolutely. And once again, but thanks for sharing. I think, what comes to mind too about like the let's talk, we alluded to, what is the data showing us? Like even in that first 3-4 months, there was some stuff that came out that it seemed to be pretty evident, and one of the things that we're talking a lot about is this outdoor transmission. And I honestly, I think there was a missed opportunity with public health. Like when we talk about people's well-being, when we were trying to reduce the risk of, getting COVID or getting sick from COVID through, not getting, when we think of the diabetes and obesity, hypertension, getting outside for your mental health, for your physical activity. What a great thing. Like what a great thing. And we know even in the medical literature, honestly, I have yet to still read a medical journal stating an outdoor outbreak of of
sure.
COVID.
And everybody talks about the garden party and then you see Trump giving cheek kisses to everybody who was outside.
Yeah.
Indoors.
And you never say never in medicine. Obviously there's going to be exceptions.
Not never.
Yeah.
And that's the problem with our society right now. It's never, right?
Yeah.
Right.
Yeah.
I have heard of this one person. Yes, it happened. But you and I know disease happens all the time, right? Like you can't stamp out heart disease. If we were going to do that, we would close every McDonald's and every hamburger joint there was here. We would actually ban smoking. And by the way, I know you and I have talked about this. 45,000 people a year in Canada die of smoking.
Yeah.
Directly smoking related illness.
Yeah.
But we never talk about the ethics of taxing it. We tax it.
Yeah.
We actually fund our society. Yeah. We benefit from people's addiction to tobacco. Mm-hmm. Incidentally, we also benefit from people's addiction to alcohol.
Yeah.
Right. And so I'm not saying that we have to prohibit these things. I'm just saying, it's very morally incongruous, if I can use that term, to be talking about certain things and not having the scope. Mm-hmm. Heck, I'm not minimizing COVID. You and I have had conversations of how impressively horrific this disease can be.
Right.
But at the same token, we got to have an open conversation about everything, everything.
Like it's even, I still, so the Quadcast Nation, one of the things, I don't know if I've mentioned this on the show, but I pointed it to you. There was a StatsCan, Government of Canada document looking at access deaths in 2020 compared to 2019. So how many more patients died in 2020 compared to 2019? And I forget the exact number, but there was significantly more access deaths in 2020. And about half of those were COVID related. The other half were like as a consequence to whether you want to say COVID or indirect causes, whether it's lockdown or restrictions.
Or the environment. I read that report.
Yeah. And it got so and it literally, and even in the report, it says it was disproportionately affecting younger people. And I promise you, no large media source covered this thing. And to me, mind was blown. I'm like, are you telling me you don't want to learn from this? You don't want to learn that some of our restrictions, some of the way we've approached things have led to more deaths in 2020, whether that's delayed cancer surgeries, whether that's suicide attempts, whether that's, substance abuse overdoses. Sure. Like, how are we not talking about? And this is my problem with the announcements today and so forth, my friend, is that if you are going to acknowledge that the measures we're going to take are going to be detrimental to our right. population, what are you going to do to address it? What are you going to do to mitigate it? If your kids, if you know there's an increase in mental illness, why aren't you offering subsidized mental health services? You know, if there's issues with substance abuse, maybe we fund more counseling. Maybe we have some messaging out. You know, why don't we have some public addresses when it comes to like, hey, like why, if I'm Christine Elliott or Ford today, I'd be like, if you are struggling, here's the line you call. Here's the line you call. We acknowledge it. We see you. Okay.
But again,
as opposed to just like,
yeah.
Oh, no, we're going to lock down harder. No, you know what I'm saying?
But that's part of the binary. Sorry, go ahead.
No, just one more thing about the Ford thing. His words were that 80% of these COVID cases are coming from 20% of the GTA like area or whatever. And I'm like, you know that 20% is representing so much. Focus your resources on that 20. You know, closing schools, closing a kid's park. Kids at a park, you're going to close down when you know it's not a contributor. You know it. Like, yes, there could be the one in a rare case or whatever. But is this what's driving it? You're going to pay attention on something like this, which has secondary consequences. I'm sorry. It's infuriating.
The problem is that law of diminishing returns. I think that's kind of what you're talking about in the way I look at it, right? The problem, it all started with the unfortunate presidency of Donald Trump down south. It created our conversation, because we're so close to them, into a very binary conversation. If you didn't talk about locking down incredibly hard early on, right, then you were on side with the Republican Party in the US, and you were on side with the MAGA movement. Okay. That couldn't be more philosophically detrimental to think about than that. And that is from an educational standpoint, from an intellectual standpoint, that is incredibly disingenuous, because we got pegged into that. Not we, but anybody who talked about, even if you said, let's lock down 90%, okay. So this is what happens right now. We're at a place where a lot of the things weren't dealt with. Again, essential workers, postal codes where people are spreading this, not because they're to blame, because they have to make a living. Yes. Do people have parties? Yes. Do we see people in houses having parties? Do I agree with that? No. But that's not the problem, right? It makes us feel good. I read this brilliant article because it makes us feel good because in Western society, my parents came to this country and said, if you put your mind at it, if you work hard enough, everything is in your control. Everything is in your control. You can do it, right? And so in their eyes, I made a success out of myself. Okay, hopefully. But that is all in my control. Some things are not in our control, and people in Western society have a hard time with that, right? So this is what I'm trying to say. That the corollary is this: when you're faced with all this anxiety and uncertainty around you, you need to put your finger on something. As a human being, you got to say, it's that person across the street. It's his kids who are playing. It's his kids who are playing in the park, throwing a football, right? And then you get the calls to bylaw about that. And that creates a sense of, okay, I've taken control of the situation. It's that person's fault. Mm-hmm. But it's not that person's fault. Society has been like this in our capitalistic system for eons now. The rich have gotten richer to a certain degree. Okay, we can argue, the economists will argue what. I'm not an economist, okay? But we can all see that the way society is, okay, there are marginalized communities. And what we're trying to doing right now is we're trying to blame people's behaviors. Yes, are there some people that are behaving in a way that is, you know, in a way that I don't agree with? Absolutely. But I have really, other than the first 3 or 4 months, and I was guilty of this, I've really come to understand that people are human beings. People are tired, and hopefully we can give them some hope with data, with vaccines and things like that, which we'll get to, I'm sure. But it's not as easy as pointing a finger. And so when we look at outdoors and we start limiting outdoors, irrespective of it's the B117, the B1351, or the P1, I know my stuff. I'm red. Okay.
Beach.
Okay. The issue at play is this hasn't become aerosolized Ebola. Yes, there's a little bit more virulence according to some of the data that I've seen. With the Lancet had a good kind of like review the other day that I read. And so, yes, I understand that. But the basis of it, whether it's 1.5 times more virulent, so that's 50% more virulent or what have you, at the end of the day, you're not going to have a pandemic spread because there's 10 kids at a park. What you will have is you really have to think about society too when you're 1 year into this, right? And you got to think, it's like the first day when we were in medical school. I remember, I don't know if you remember Ryan Zaranchansky.
The ICU guy.
He's an ICU. Yeah. But he was a medical school president at the time, or student council president in medical school. And I remember the one thing it stuck with me, what he said to us, and he said, "It's a marathon. It's not a race."
Yeah.
And when you're dealing with a pandemic, you have to we're lucky that vaccines came out this quickly. If this was a 5-year race, I'd be really worried right now. Right? But I'm not worried because I know what's around the corner in 8 to 10 weeks. I know what 50 to 60% vaccination does to a society in this, because we have proof. But my point is, it's very, very important to kind of take the marathon approach and to think, if I'm preventing 5 infections in a day in Ottawa or in Yellowknife or in Winnipeg or in Vancouver, because of these measures, it's a law of diminishing returns in my eyes, because number one, a lot of those people are going to be publicly shamed outdoors. So what's going to happen is they're going to go inside. Mm-hmm. Do I want them to go inside? Absolutely not. Do I follow public health guidelines? I do. Okay. And I've said many times that I've been a huge proponent of Ottawa public health. Okay. Mm-hmm. But of course, we have some disagreements intellectually on certain minor things. But at the end of the day, I will always feel that no matter who we are as physicians, and again, physicians, I don't think should drive the discourse of this at all. I think every part of society should drive the discourse on this. We need to understand the law of diminishing returns. If you have people not congregate in a place of 50 people from different households indoors for 2 hours, I get it. At some point, you got to close that down. Yeah. I get it. Even if it's going to hurt, it's going to hurt business. I'm happy to dig into my wallet for the next 10 years to help that person out now and raise my taxes. But when you're talking about outdoors, we have to remember there are 2 spheres in our society, okay? Like physical dimensions. There's indoors and there's outdoors. The only other physical dimension is space, right? And I don't know how to go to space. So
talk to Elon Musk.
But do you understand what my point? I'm not trying to be facetious. Like, you're either going to spend time indoors or you're going to spend time outdoors. And behaviorally, people aren't going to spend time indoors for 2 years.
Yeah. So
there comes a point where you have to understand trade-offs. And the trade-offs for me is outdoors is a lot safer by 10 times at least.
Or more than, in my opinion.
I'm just saying, I'm being so conservative right now. It's I have a hard time even saying those words. But it is so much safer. And I understand, yes, if you're kissing and hugging and spending 3 hours in front of each other outdoors, people are going to say, well, that's going to cause spread. Okay, that's fine. But then educate people, be partners with people.
Yes.
This is what I want to do. I want to drive conversation to say, you know what? Come into my backyard. Like Wendy would say, I'm not going to go against anything public health is saying now, but I'm going to say, you know what? Come into my backyard. You know, I put a TV in one of my good friends in the neighborhood during the pandemic when we were allowed to do this. Put a TV in my backyard. I put an outdoor sofa. He sat on one and I sat on the other. We were 10 feet away from each other. That gave me enough energy to do another week of ICU.
Yeah.
I needed that.
Because you know what part of being a human is? Connection.
Absolutely.
Interactions. And once again, I think we missed the boat when it came to the harm reduction approach. You know, I think you get much more buy-in when you're saying, hey, this is how you do this safely. If you're going to gather during the holiday, do it outside. Heat lamps, fires, whatever it might be. You know, like if you are going to watch the Super Bowl, we watched it outside as well. A buddy of ours had a nice setup outside, and it was brilliant, you know, and it was everyone stayed safe and at a distance. Like, preach this, you know, as you said, this is a marathon, not a what is it? Marathon, not a race.
Not a race. Yeah.
Well, a race is
marathon, not a race.
You know what I'm saying? I always mix metaphors, so I never trust
I'll
myself.
text it to you in the intermission.
I never trust myself. You know what I mean? But like, oh my God. But I mean, this is another issue too. Like I think this has been a media issue too. Like just how the messaging and the fear has been so amplified. So we'll talk about vaccine in a second, but I had a good buddy of mine. He texted me, he was a 5-year-old, went to, because, you know, the variants, you know, like everyone's very fearful of the variants. And, you know, he's out in Alberta, took the kid to the park, forgot masks, and thought, you know what, we'll just do this without masks outside at a park when everyone's distanced. And he texted me saying, like, do I have anything to worry about? And I'm like, oh my God, like if you actually are at the point where you think you had something to worry about, to text your buddy that probably you haven't talked to in a few months or almost a year, like that's a lot of fear. That's a lot of anxiety to be living with. And let me tell you, that's anxiety that gets pushed onto your kids when you're having that level of.
It's anxiety that gets pushed onto you. It's anxiety that causes burnout. It causes decreased production in your work. It causes decreased GDP. I mean, at the end of the day, I mean, you know, this is our silent killer, right?
Absolutely. And to think you're bringing that much fear when you're going outside to a playground with your kid, you know what I'm saying? Like, there's not much of a safer activity that you can do. You know what I'm saying?
That's unfortunate, right?
It really, like, it made me.
You can't devise a societal structure where people stay indoors for 1 year.
Exactly. It's not. Anyways, like it's just,
you know what I mean? FaceTime doesn't cut it for a year. I mean, I understand now. I'm not telling anybody to go outside now and have a 30-person gathering. That is not what I'm saying. I even feel so disingenuous intellectually to even have to validate what I'm saying to prevent people from thinking that's what we think just by trying to propagate, you know, that, you know, a lot of people say, well, why are we talking about this now? Well, that's what got us here.
Yeah.
Do you understand what I'm trying to say? Of course, now, you know, you and I are going to be working our tail ends off. And, you know, like I said, we walked the walk. We risked our lives for 10 months before we got vaccinated. Yeah. Okay. So we get it. Okay. Mm-hmm. And do you think I want to spend time away from my kids and doing extra shifts all the time? Absolutely not. But I'm going to do it because I have to do it. Yeah. And I have okay. But at the end of the day, let's kind of look at certain things that will keep us homogenized as a society. There's too much disagreement right now in society that's not healthy. You know what I mean? And it's 100%. Very binary. And I'm worried more about that than the effects of COVID after the next 2 or 3 months.
It's a good point, because I think even before COVID, I think I don't know if I've had this discussion with you, but one of the reasons why I think I really want my kids to go to post-secondary, even if they, whatever they end up doing, and whatever subject matter, is because I don't know if we teach enough about critical thinking, like how to evaluate, how to know whether a source that's or like to recognize biases in reporting, in a journal article, and on the news. Why are they framing it the way they're framing it? And so I felt like this was a problem even beforehand. And now that we're even being more pushed towards dichotomous thinking, binary thinking, like it's going to be worse. You know what I'm saying? And I think that for me as a father, this is there's a few things that are important values for me, but my kids got to be able to dissect. They got to be able to think through a problem. They got to see the multiple angles. What are the biases? Because it's tough to navigate life without having that kind of open mindset, that framework, So I am really, I am worried about that.
I'm worried about that because look, you and I work with clients who have addiction issues, right? And there's so many biases that go into that in the general population, right? When I walk into a situation like that now, from all the experience I've had, I can truthfully, honestly say that for the last 10 years, I go into it exactly like I would somebody who was in exactly my privileged position to be in. Okay. If it was a doctor that I was sitting there who didn't have the same health issues, or somebody who is really struggling to survive with multiple addiction issues, I spend time. I mean, my style. Okay.
Yeah.
I spend time. But the most important thing is I don't judge that person based upon my biases anymore. The reason why I say anymore is I'm man enough or human enough or whatever you want to call it to admit that, I always have a learning process, right? If I learned the way Twitter kind of through Twitter discourse right now, I would never be able to put myself or empathize with anybody. I understand the people who are scared. I even understand the people who I completely disagree with when it comes to shutting schools down for a single, like for forever until there's not one case of COVID, because I understand where their fear comes from. I don't agree with it. And there are certain situations where I can say, okay, fine, what have you. Anyways, we'll get there. But we have to come to a point in our society where we understand our biases, we try to learn on them, and we stop having binary conversations because they lead us down this path.
Yeah. If
we were able to have conversations that were honest and true, if media didn't give 2 to 5 minute snippets on something, but had an honest and detailed discussion, not having two pundits, one on one side, one on the other, like some American cable media, and just have them talk over each other, right? That's what sells. That's what gets your attention. But that doesn't solve society's problems. Numbers,
healthcare.
Yeah, but numbers, look, I'll tell you something personal here. So my wife and I, the alarm goes off at 6:50 around every morning. My wife likes to listen to a radio station. And I had to tell her, I can't wake up with this every single day. I know the stats. I get it. Right? But it can't be like the beginning of Star Wars, today in Ottawa, like, what are we doing? Like, do we
sells,
not?
Man.
But it sells, right? And I'm not saying that people aren't dying and we know better than anybody, but that's not the way to communicate. That's not the way leaders communicate. That's not the way people with passion about saving lives communicate. Fear is not a motivator. It is so, anybody who has done medicine and has paid attention has realized that people's attention to fear only takes you so far. You know, I'm very passionate about this. As you know, psychology is one of my things that I have I am very passionate about, because behavior change doesn't come from fear. You and I have had patients whose both parents have died of lung cancer.
Lung cancer, yes.
And who smoke 2 packs a day.
Mm-hmm.
Early on in my career, I said, what are you doing, guys? Your parents died of this. And I wasn't dismissive. I wasn't rude. But even as kind as I was like that, it never registered, because I had to get into why they're doing it. I had to help them. I had to understand, where are they in the process of change? Are they even interested in change? And that's a process. But fear itself, people tune out. And so if you want to talk about why we're here, fear, people tune out, and then they feel scared because they don't have any guidance anymore.
Yeah.
You can't keep scaring people all the time.
Yeah.
You know, and this is where I think modeling went wrong, because I think the modeling here has been actually pretty decent, I think.
This time around.
Yes, very good. But here's the problem with modeling, is that there's so many different modeling out there in the last year, that if you actually look at every single one, many times it's been off. And the problem is that it's like the boy who cried wolf. And that's unfortunate, because there are very smart people in the epidemiology, the modeling world. They're brilliant. Their heart's in the right place. Like, I don't begrudge any of them. The point is, that's not how you make an argument to a society. Mm-hmm. You know, when in London they came out with the initial models, it scared everybody. It kind of worked for about a month or two, but it didn't come to fruition, right? To that degree. And then everybody started saying, well, you know, look, what do these scientists know, and things like that. Okay. Mm-hmm. Most of the public hasn't been trained as scientists. We know that there are hypotheses that are debunked. Some of them are 50% true, 60% true, 40% true. But the problem is that we understand it. A lot of people in society look at that, and you know what they say? They say, well, these guys don't know what they're talking about. And that's the problem. It's not that the modelers are disingenuous. No, I know some of them. I think they care. They're obviously very passionate about. It's just that in a way that should be part of the decision-making process, where sociology, psychology get together, you know, epidemiologists get together, and then we sit down and we say, not me and you, because I just want to do my ICU work, but then say, you know what? This is how we message this right now. But when people go out there and it sounds like you're sitting through a conference, don't tell me you haven't felt like that in the last 6 months sometimes. Yeah. When you're watching CTV or CDC and you're looking at somebody talk and you're like, I'm literally getting CME credits for this.
Yeah.
People don't tune into that. And it's not because that person might be the most brilliant person in the world. And I know some who I have a lot of respect for, even the person I'm talking about right now. But at the end of the day, they're not the right communicators. Communication is so important. It's so important in public health right now. Like, I'm not public health, in everything that we're doing right now.
I mean, even think of our jobs. The greatest people, the greatest docs we look up to have always been great communicators. But this is something that I once again, I keep saying missing the boat. But imagine if the messaging had just had that positive taint on things. Like, guys, you could do this. We could do this together. This is what we're going to do. This is our part. Our intensivists are going to do the best.
Bonnie Henry.
Yeah, absolutely. Preach. Like, we're going to do our best to do our part. We're going to be there for our COVID patients. You guys, what we need you to vaccinate. We need you to reduce your social gatherings. We need you to do, this is what we need from you. But you know what? We know we could do this. We can do this together. We got this, guys. Imagine that message that
let's shift. Let's shift onto that, because people need to hear this stuff.
Guys, it's on you. All you had to do was lock down, stay home a little bit longer, especially you essential workers, even though you need to go to work and you don't have the chance to lock down. And I wonder why lockdown's not working, because you're still going to work. you still have to go to work, and you are in an area that spreads the virus quite rapidly.
How many essential workers have we seen in our ICUs?
It's insane. In the beginning, the PSWs, the people in long-term care, and if it's not directly essential workers, it's an essential worker family member.
Absolutely.
And like it's, and I'm telling you, and like I'm gonna say this, like full disclosure. This is one other thing I did recently. So full disclosure, third wave, I vastly underappreciated the severity of this wave.
So did I.
And you know, I went on Twitter the other day and I said, I'm going to admit that I got this wrong. And I'm doing this because I want to be an example to other physicians, leaders, whoever, to say that admitting that you're wrong has value. So we can have that open discussion. I want to learn from my mistakes.
Well, that's part of science, right?
Absolutely. And so,
I mean, Galileo he'd still be stuck in a house.
Exactly. I don't remember where I was going with this point, but but
my bad.
No, it probably wasn't that valuable anyway. But the key thing though to me is, that we had signals, we had clear. Oh, that's what I was going to say. I got a lot of things wrong, but the one thing we've been saying from early on this thing, I could even find you media coverage about the essential worker piece in November. You know what I'm saying? And we chose to ignore this. But anyway, I just think it's just frustrating when you were.
Dr. Chagla was talking about it. Dr. Chakrabarti was talking about it. You were talking about it. I mean, there was even some very good articles that were written in some of the mainstream newspapers that I know that that you put out. And they were very, very well written and succinct. I mean, I read them and they made the point very well. Mm-hmm. I mean, it's gotten to the point now where there's over 600 medical students in Ontario that are advocating for this right now.
Oh,
right?
Wow. No, that's, I didn't know that. That's amazing. But, and when it comes to the messaging too, like instead of like, there's a lot of shaming and misinformation when it came to the vaccines. Like, I can't believe how we fucked up the vaccine messaging. Like let me break this down to you as clear as day for people. Okay. In the studies,
this is where I like to go.
Yeah. In the study participants. Okay. I think it's now 130,000.
Correct.
130,000 study participants in the vaccine trials, and 30,000 being 12 to 16-year-olds. And one person was hospitalized out of all those people. But you're not going to hear about that. You're going to hear about this efficacy, which is telling you, hey, yeah, man, AstraZeneca, 68% efficacy for mild disease. So people that had sniffles or mild cough or symptoms where they weren't needing to go to a hospital for, okay? But 100% when it came to hospitalizations.
Okay, so you know what that's like? You know what that's like?
What's that?
Okay. I come down with rheumatoid arthritis. I can't walk one day, right? Let's say this is not a true story, but I'm my whole life has changed. Somebody gives me a drug that in 95% of people completely obliterates rheumatoid arthritis. I don't even have a sore joint when I wake up in the morning. I don't even crack my back. The other 5% of people, okay, their knee kind of hurts, but they can play with their kids. They can go on bike rides. They can
kicking.
They can do whatever you're doing right now. God forbid. Do you understand what I'm trying to say?
It's crazy. It's crazy.
And this is how it's put on newspapers. And there's like, we have a breakthrough sore knee. There's a doctor in Ottawa whose shoulder hurts today.
Yeah. His left index finger is glowing in the dark.
Or God forbid, you know what? He had 2 days where he was feeling unwell and had to take Tylenol and had a fever. Understand what I'm trying to say?
But it's what's opening the news.
Correct.
That doctor with the pinky problem is opening the news, not the 100%, like literally as close as you can get to 100% on hospitalizations and death.
And look, and we know real life, look, we have to prepare people for this. Real life data is never as good as, whatever.
Trials,
but even the CDC, and I understand you need more time to get perfect numbers and stuff like that. But if we've ever had a crystal ball, right? Take a look at Israel. Take a look at the UK. Right?
US now, boy.
Yeah. So they have a combination of, maybe 40%, vaccination, at least one person. They're going higher. Canada's in the 22% range. But we're not at that level yet. And they have a lot more natural immunity.
Yeah,
natural immunity that they have is not going to give them herd immunity. I get it. Stop the letters.
It's okay. People. Yeah.
Okay. But you either get immunity from one of two ways. You either get it or you get a vaccine. Right. And so that's just real phenomenon. I'm not saying that I advocate getting it. I don't. Isn't
it funny that you have to say that though?
It's horrible.
Is it funny?
It's horrible. A guy who basically overcomes OCD, works in, risks his life. And now I have to advocate. I have to contextualize everything with, I don't wear a MAGA hat.
You know what's,
I'm the biggest Biden / Obama / Jimmy Carter like proponent there is in the world. And here I am kind of like saying okay, so let's just leave that aside. Okay.
Can I just add one more thing to this? One of the things though, I don't know if I have the gumption for it, but as I think maybe as we get more and more into leadership positions, I wonder one of the stances just to not give a shit about this, like partisanship. You know what I mean? Like, I recently got linked with a tweet where somebody was like, "You're associated with that person," and I'm like, "Look, I don't even know who that person is. It's what is in the content of the tweet. Focus on that. I don't want to get caught up in this,
Like you're responsible for everything that person has ever done in their life or said in their life, right?
Anyways,
you have the time. Wait a second. You have the time as an ICU physician, okay? to basically run a Truman Show on this person's life or whoever it was. I don't know who you're talking about, but I mean, come on, the guy, like now we're in the, cancel culture of like everything, right? Like they're trying to cancel everything you have to say. You don't have the responsibility to back check absolutely every single person's life and decisions.
Yeah, no, that's what I'm saying. Sometimes just lead by example and just not even and ignore the criticism. But yeah, I think this would have been great to really if the messaging was better. Even like I saw a great tweet in terms of the AstraZeneca clotting risk. Yeah. You know what I mean? Like how many, like a lot of females are on the birth control pill right now, and you're looking significantly higher risk than the AstraZeneca vaccine, as the data is showing. But like once again, media just attaching to that. And how many messages have you gotten from people about whether they should be taking the AstraZeneca?
But I actually, one of the things that I did, I used to, I actually did some extra training in thrombosis with, and so I ran a clinic with the supervisor. Yeah. And so I don't pretend to be a thrombosis expert, but I did 2 years of it in a clinic once a week. Learned a lot about it. Thought it was very interesting. And of course, we all know that there's a lot more risks of thrombosis. I mean, what's the number one risk? Well, I shouldn't say number one. What's the biggest risk right now of thrombosis is COVID.
Yeah.
I mean, if you look at it on a percentage basis, I don't know if people know this, but if you're admitted to hospital and you don't have a very high risk of bleeding, right? With COVID disease, you're on oxygen, you come into hospital, the standard of care in a hospitalized patient that's not in the ICU is full dose anticoagulation. What does that mean? We give you full blood thinners.
Yep.
Why do we do that? Because studies show that you do better if you have it, because people actually with COVID have thromboses when they come into hospital. Mm-hmm. I mean, but this is where, this is why I take my car to a mechanic, right? Because I don't understand the ins and outs of it, right? This is complicated stuff, right? It's nuanced stuff. It's based on evidence-based, but at the same token, medicine is also an art. And it's difficult to try. That's why when I'm in a 747 or an Airbus A380, I don't go to the front of the cockpit and start going, What are those beeping lights? Can you turn that off? It's bugging me.
Or what is it? Yeah. Or you might want to.
But there's a lesson in that, right?
Yeah.
I'm a horrible flyer. Honestly, I'm like, when there's turbulence, I like go ding, ding, ding. When's the turbulence going to stop? When's the turbulence going to stop? Like the flight attendant knows, right? But I need that reassurance. But I've never walked into a cockpit. I'd like to, but I know there are rules. Do you understand what I'm trying to say here?
Yeah.
I'm just trying to say that, okay, so now going on risk, right? Which you say. So I think we have to actually really take a really hard look at this, right? Everything that we do, every medication that we have has risk, right? Like all of a sudden, I mean, so far the mRNA vaccines from Pfizer and Moderna seem like, I hate to jinx it, but they seem like a godsend, right?
Yeah, almost.
But it's like, okay, if that's not time of the year, then person of the year for time, then I don't know what is, right? I'll give it to mRNA vaccines. That being said, like you said, the AstraZeneca vaccine, from everything that we know, is a phenomenal vaccine. Look what it's done in the UK, right?
Yeah.
And there is no reason, in my view, not to use it with certain age groups here. In my view, Health Canada has approved it. I trust Health Canada. I've seen the data. I've seen the studies. And as far as VIPIT is concerned, or vaccine-induced, thrombosis, the reality is that it's a very rare event still. Okay. And so this is what I mean about having a society that allows us to talk about trade-offs, right? When I vaccinate myself, I was one of the first, I think 20,000 people in Ontario to get the vaccine. Like, there's a certain,
we were early.
There's a certain risk, I guess, because, whatever, but now we know even a lot more about it. So now there's almost, I'd have absolutely no hesitation. Okay. But even in emergency use authorizations, the US has, and Canada has the same, corollary. I had to sit there and say, okay, what do I know? And what are my risks? Well, I go to the ICU all the time. I'm exposed to COVID. I'm in my 40s. And here I am. And this gives me this gives me that. I happily take the incredibly small risk, right? And it's informed consent.
Yeah.
Right? It's informed consent. Now, getting onto this. I think that, and I'm going to harp on this again, every single journalist out there who writes a story with a headline that's attention grabbing should look at themselves in the mirror and say, how am I contributing to this pandemic?
Yeah.
How am I making things worse for people? You're not just writing an article informing people. There are very good health reporters out there who do a phenomenal job and don't fear. But when you put out a story that says a double vaccinated person got COVID, what are you trying to do? Are you trying to break Watergate? Do you really feel that special that you have to do that as a human being? Think about how many people you're hurting by that message, because that is not an evidence-based or data-driven message. That's an anecdote. It may be true, but when you have 8 billion people in the world and the US is vaccinating 4 million people a day and Canada is vaccinating 300,000 people a day, per capita, we're now vaccinating, thankfully, 70 to 71% the rate of the US. When you're getting that many people vaccinated across the world, and it's going to skyrocket in about 3 months around the world, how do you not expect there to be some breakthroughs, right? Like that's intellectually disingenuous of anybody to look at that and say, wow. So if you're just doing it to get a paycheck, then you're hurting people. Now, write an article that is balanced, that is fair, and that tells people this is your risk, this is your risk, this is what the European medical agencies basically said about AstraZeneca. This is what Health Canada found, and there have been very good reporters in Canada, the US, in the European Union who have done that. But there's been a lot of people. And we have been too kind to that.
Yeah.
Too acceptant of that as physicians.
It's like the lack of integrity. Again, I'll tell you guys this too. Like, I've been censored by, I won't say which news network which does it heavily, but I've done interviews or pre-interviews on certain situations, and I'm less dramatic or sensationalized than a colleague, and they won't air my piece. They'll be like, "Oh, here, tell us about COVID and the how much younger people are dying from COVID with the new variants." And I said, there might be slightly younger I'm talking my experience, slightly younger. Yes.
Well, there's data, right? And we can talk about that. Let's talk about that after.
Yeah. Like slightly younger, but am I seeing significantly younger? Not in my circumstances. I still see the same metabolic profile, and just goes to show we just really need to get our vaccines out there. So not a lick showed up on that network. They were like,
what happened to me the other day?
What's that?
I read a sports story. Okay. And it compared, and it was talking about how Canadian teams are vaccinated less. Okay. And the writer basically, anyways, long story short, I reached out and tried to correct them because their stats were incredibly wrong with regards to number of people in Canada vaccinated. And so I said, well, actually Canada is twice as much as what you have in your story. Crickets.
Of course.
After the first one.
You're not going to get love.
Crickets.
You ain't going to get love.
And I looked at the story 2 days later. Nothing.
Yeah.
Still there. Still wrong. And, I hate being that person to say this, but the problem is that I really respect journalism that is balanced, that shows data. And if it shows an opinion, it's an editorial, that's fine. I read a lot on my off time. And I enjoy well-written articles. But if it's just in order to say a stat without any kind of ownership of what you may be doing with that message, I think that is unethical. I think you're truly, and that's when people tune out, Quad. That people tune out.
Yeah.
And I'd love to have like a platform where I can just talk to people for like once a week or what have you, and say, okay, well, like, let's discuss these. Yeah, well, exactly. Well, this
is the joy of these platforms, though, because you get to funnel through the nuance, whereas you get an interview on a network for 4 minutes. It's hard to explain some of these issues. So what were you mentioned? There's two things I want to be able to catch before we jump off. Was the variants in schools? You sounded like you wanted to bust out something about the variants.
Well, so I mean, I think you mentioned it with regards to the younger population. I think, look, at the end of the day, our infectivity rate right now is much higher than it's ever been, right? And so I think we're obviously in a significant health issue in Ontario, and you and I and everybody else, and God bless, all the healthcare workers out there right now who are going to have to go through it. I'm fine. I don't, whatever, like this has been okay with me. But there's a lot of people who are really, really, really have really put a lot of their lives on the line with a lot of this. And that's taken a mental toll on them.
Amen.
And the respect I have for the people that I work with every day is ridiculous.
Never been more, ever.
Exactly.
Like it's incredible.
That being said, we have to say that, again, we don't live in a binary world. And when we use fear as a messenger, we're going to have diminishing returns in the long run. Look, we have a very difficult virus on our hands. When I came into the ICU in May, we saw 70-year-olds to 79-year-olds, 60 to 69-year-olds, clients, patients. Basically, at the end of the day, because really we didn't have the infectivity that we have now. Of course, we had 30-year. I had 30-year-old. I had 30, a 40, several 40-year-olds.
Yeah.
Right. But now what's different is you just have to look at the amazing job that vaccines have done in our long-term health care. There's 75,000 roughly people that live in long-term care. About a month ago, there were 5 or 6 that had a positive test in all of Ontario.
Wow.
Okay, think about it for a second. Even though we were rising, even right now, there's 28 people, 26. I don't know, but I'm not way off. Think about that for a second. When there's an 11% positivity rate around 10.6% in Ottawa, and an 8 point something positivity rate across the province, or you know what I mean? Okay.
Yeah.
You're telling me that if we had that positivity rate without vaccines, you know what would be happening right now in long-term care?
Apocalypse.
It would be horrible.
Yeah.
Okay. And that was our savior. And so now what we see is when we start vaccinating older, our elders and people who are above 60 years old, thankfully, once they get to the 2-week, 3-week, 4-week mark, we see less and less of that population come into our ICU, but we still have a 10.6% positivity rate in Ottawa, even when we're testing 3,000 people a day. That tells you it's everywhere. I don't know about you, but like I start knowing people that have gotten really sick all of a sudden. That never happened in the first wave or the second wave for me. Like I'm talking about like close friends.
Yeah.
And so the reason why I'm saying that is it's everywhere. So when we talk about fractions, yes. Do I think that this is more virulent? Yes. But it's not like this virus now all of a sudden said, I'm going to make a sharp left turn and I'm going to go after 30-year-olds and I'm going to forget about 60 and 70-year-old patients.
Yeah.
Like people, right? What we're seeing is vaccination, a more virulent virus to a degree. Yes, it's different. It also spreads a lot easier in confined areas. So essential workers, a lot of them are younger. If you work at a restaurant, if you work, at a bar, not a bar, but like a restaurant or, a sit down bar, or if you're in any congregated setting, then it's going to spread more. You're going to infect more people who are younger, and fractions are a numerator and a denominator, right? So when your denominator goes up, your numerator is going to go up. And so that's what I think we're seeing. Plus it's a little bit more virulent for sure. So at the end of the day, I guess the message is, yes, let's do everything we can to curtail this, but I don't want everybody at the end of this to have anxiety disorders for like 5 years.
Yeah.
Right? Like if you're 25 years old, like you don't have to walk around thinking you're going to die of COVID. Yeah. That is disingenuous of us as professionals to do that. Right? There's like driving a car is more dead. Like if you're 20 years old, driving a car is more deadly. There's no question.
Yeah.
Right. And so I don't want people to think that, yes, okay, do we see it? Have I seen a 31, 32, 33, 34-year-old? Yes. But I've also seen people with I've seen people with unfortunate cancers. I've seen people with horrible pneumonias who are healthy and lifeguards at like 25 and 26, who didn't have any comorbidities before. I mean, we've all seen this kind of stuff. Not saying that they can't get affected, but unless you're completely honest with the public, then everything else that you say afterwards is read through. They listen to you through a different lens, right? So it will always be more dangerous for the older that you get. That's just the way COVID is. That's the way coronaviruses have been the last 3 that we've seen. Mm-hmm. But at the end of the day, yeah, of course, do we do it from a public good? Yes, that's what I want to get out, right? Do you want to congregate with 30 people indoors? No. Why? Chances are you're not going to die of it. But when you're 25, but you will potentially hurt your 60-year-old father who has diabetes, or your 60-year-old father who is very healthy. Okay. Mm-hmm. That means I have seen that too. So at the end of the day, I really think it's important to contextualize that message and to say here we go again, trade-offs, which is, I really do feel that outdoors is our lost kind of bargaining chip with the population. I hate to use that word, but this togetherness that we have to have together in order to kind of like get through this together. Mm-hmm. That's our ticket to say, okay, I get the fact that you're in your 20s. When I was in my 20s, I didn't have a support network. I didn't have, we never talk about that. I didn't have 3 children and a lovely wife and like a partner that I can depend on, right? My social network has been cultivated for the last 20 years, right? But when you're 21 and 22 years old, right, we're asking a lot of these people to kind of say, okay, well, stay in your house all the time and you can't go outside and you can't go to a park and you can't like socialize and you just use FaceTime for a year and a half, perhaps. What I'm trying to say with that is, let's have a partnership. Use people in that community and say, if you're going to socialize, let's do it like this. We need you together. We're a community. But if you go out there and you say, you're going to die, you can die. And you put pictures on TV of young people, which I know has been done. That bothers me.
No. Or they'll interview.
I know it comes from a good place from people that are trying to do it, but it's not effective. We tried that with your brain's on, this is your brain on drugs. We tried that with smoking. It doesn't work.
No.
Right? We have to be a community.
Yeah, man. We have to.
Do I sound crazy when I say we have to be a community?
No. I mean, this is what people relate to. This is how you engage them. This is how you create change. Is like have that community feel. This is as we said, part of being a human being and why it's so important is this is how you effectively communicate. That's how you effectively reach them, is by really creating that community. Last topic. What are we saying about schools right now?
Well, I think, okay, this is what I will say about schools. I think that I don't want to get into epidemiology and stuff like that, because that's for a CME credit. I want to talk about the importance of schools. They, in my opinion, should be the first to open and the last to close, period. Let me say that again. I think they should be the first to open and the last to close. Do I think that when you've got 20% positivity in your community, we don't, but let's say whatever, you pick your number, whether it's 10 or 15 or 20. Do I think that, again, this is not a binary issue. Do I think that there is a time for online schooling? And okay, I actually think that yes, there could be, but huge, but we were talking about taking kids out of school when we had 2% positivities and 3% positivities and 4%. I don't want to get into too much numbers, but to say there was dialogue out there that I thought was wrong in my perspective, that suggested that we have to have schools shut down because they were a significant contributor to spread. I don't believe that based on the data that I've seen. Let's make the intellectual argument that they were somewhat of a moderate contributor. Talking about our children as vectors is beyond my comprehension. We've relegated psychologically children to being as vectors. And if anybody thinks that they don't internalize that, they don't have children, or they haven't talked to children for a long time. Or let me be less, because I'm breaking my own rules here, because I get passionate about this. I should walk the talk. I do believe that children internalize that. I think that education is a right that should be taken away, like in-person education, socialization for young children, at the last resort. Do I think that perhaps we're at a last resort in Ontario? Perhaps, but we weren't there, in my opinion, on multiple occasions. And I don't think that people recognize the damage. And yes, there's going to be children who do very well, right? And they're going to say, well, schools were part of the industrialization of society and so forth. But this is the society we live in right now. We are an industrialized society. We're not a farming community anymore, right? This is the world that children live in right now. I'm talking about a farming community. I'm talking about like 90% of our industries isn't that. So parents go to work, children socialize in networks that aren't communities like they used to be before. You don't have your neighbors coming in and the children, during the day and kind of, right? Children need socialization. They need networks. They need to grow that way. And so I think it's vitally important. I mean, there's statistics of many, many children in Ottawa and Toronto who have just been, who've literally dropped out of school and have been lost. And the people that are going to be affected by that aren't necessarily the people who are economically well off or
marginalized
socially well off.
Racialized communities too, man.
Right. That's their that is their, and that's how you keep a society afloat. You need glue, you need connections, right? And so I understand the predicament we're in right now, but I really do think that as we go forward, we don't move the goalposts with schools. I think once teachers are vaccinated, I think once we get to a certain level in our community where the viral spread isn't as big, that kids go back to school. We are prioritizing other things above children right now and collectively over the last 14 months. And I don't think that kids have a lobby group. I don't think that kids, and I don't mean that in a bad way. I mean, look, we have an organization that represents us. Every I'm not against that, but they don't have a voice a lot of times.
That's the problem. You know what I mean? That's why
everybody else does.
Yeah, and I agree with a lot of what you're saying. I don't know what the magic bullet is when COVID is as rampant as it is. My opinion, I would view it as an essential service, essentially saying it's the last to close, first to open. But if there's some recognizable issues, like if you can't staff your school because of so much community
Absolutely.
spread, that's an issue, like straight up. But I just think, as you said, the times where we've decided to close in the past, I couldn't get behind that, and it's just, and because of the science too, in terms of like, it's quite apparent that secondary attacks or like kids passing along down the road to other kids is low. You know what I mean?
Sure, and the variants haven't changed that with kids as far as what I mean. Everyone's gone a little bit higher, right? But yeah, but it hasn't disproportionately affected children. Is what I'm trying to say, right?
And so and I'll say this too, like virtual classes. This has not been evaluated. This is uncharted waters, people. We're on. I don't know. I'm going to mix analogies or metaphors again. You're on the Starship Voyager doing some crazy.
Starship Voyager.
You know what I'm saying? Luke Sky Trek. But anyways, I think we're on the same page here that, it's the kids have lacked a voice, and the data is shocking on how schools, in my opinion, how safe they are. And so when things settle down, yeah.
So let's talk about this for a second, right? Let's go into a small uncomfortable area. Okay. What is open? What like I don't mean to say like why in the past have we prioritized the trade-off of let's say by just opening schools, things go up to a certain degree. What if we make a world right now where another virus comes in 2 or 3 years and we just don't have a vaccine for it? Let's just make this world up.
Yeah.
Okay. Are we going to shut down schools forever?
Yeah.
Do you know what I'm trying to say? So we have to play those philosophy games like I did in university. I mean, these were real questions. These aren't taboo questions, right? We have to pick what is important to us in society.
We got to pick our values.
We got to pick our values, and education is a value. Sorry. education is, in my opinion, is one of the top priorities, because you don't educate your society, you got a problem 10 years down the road.
Yeah.
You got a huge problem 10 years down the road. And for those people who say, I don't care. What do you mean you don't care? You want your society to go, belly up because there's
going to take care of you when you're sick. Who's going to, you know what I mean?
Society's function.
Yeah. No, I mean, to me, that, honestly, like when it comes to the values side, like you and I have had a lot of conversations offline about, when to speak up and when not to speak up. And to me, the kids, the fact that they've been the forgotten voices in here, I'm like, this is a sword that I'm willing to jump on. You know what I mean? Like, I can't, as a father of three, both of us are father of threes, and we've seen, and we've got resources. Okay. Mm-hmm. And I've seen how it's impacted my kids. I know I've heard how it's impacted.
Yeah. No, it's impacted. Yep.
You know what I mean? And so for us to just sit on the sideline and just say, hey, okay.
I'm not being a parent.
Yeah. No. Like, sometimes
I'm a
enough
physician,
is enough.
But I'm a human being. I'm a parent, and I will make no excuses for being the president of the lobby group for my children.
Yeah.
And I don't mean that I don't care about other people. Of course, I care deeply. My ethics, but we have to take children's consideration as we move forward. I have a lot of respect for public health here in Ottawa. I really do. You know that. I've been very honest with you about that.
Yeah.
And people are really trying hard, but as a society, right? We're too easy at the switch to say kids are vectors, shut it all down right away. Mm-hmm. We don't recognize what that causes, right? Yeah. Like, there are trade-offs when you make these decisions. And right now, you can make an argument, fine. But let me tell you something. When the goalposts are changed 4 months from now, I'm going to be vocal if my kids aren't back at school and there's 70% vaccination and we can't look, there's been the influenza. I'm not equating influenza to COVID. That would be ridiculous. But what I'm trying to say is viral spread has happened through schools, daycares. I remember when I was working, one of my first in my 6th or 7th, when all our kids were in daycare at one time, I remember somebody coming up to me and saying, you got to get your immune system checked. And I was like, why? They're like, you have a cold every 2 weeks.
No, man, it's like daycare with Jones. Yeah.
Right. But so what are you going to do? You're going to shut down daycare forever, shut down schools forever? Like, I guess we have to talk about this. We have to be okay. Like, we can't, I've seen some things on Twitter, until there is no infections.
COVID-0.
You cannot have kids in school. Yeah. And I guess what I'm trying to say is, well, I don't subscribe to the COVID-0 philosophy. I just don't think it's attainable. I respect the people who think that it does, because again, I don't feel like I have to rise to the occasion to listen to that side too. And I have listened to it, but I respectfully disagree. And that's okay. And I'll have a discussion when it's okay and safe. I'll even invite them over to my backyard and have a discussion, and let's see if they can change my mind on that. And that's fine. But that's what science is about, and that's what public discourse is about. Amen. We have to get there as a community.
Amen. Listen, Quadcast Nation, this is where we're going to jump off. This was one of the most therapeutic conversations I've had in a long time, Dr. Psarras. After a day, well, more than a day, several days of feeling yucky, for a lack of a better word, of how we've been approaching things. And, and it's hard too. Like, you and I are both going into the next 3 to 4 weeks of ugliness, of what we're going to be dealing with on the front lines. But the response and how it affects so many others is probably what's going to keep me up at night, as opposed to going into work. Because I'm going to speak for you. We can handle what's coming next. Like, we will handle it, and we'll get through it. Well,
we need leaders in the ICU community to be strong, for our patients and our society. Understand that we're going to go through a very rough time in the next month.
Yeah.
But I will be there. I will hold people's hand. I will do my darnest to help them through this. But I also recognize there's a lot of pain in other parts of society right now. And I've seen lots of my friends really hurting in other ways that aren't don't have that lens on it right now. But as an ICU physician, my job is to go in there, is to help people, and I'm mentally strong. I'm there, and nothing's going to stop me from taking care of them, because that's what we need right now.
That's what we need.
They need us to be strong. And sometimes people say to me, sometimes they see you, and people have said to me, they're like, "Oh, wow, he's really positive." And I said, "Well, what do you want an ICU doctor to be when you come in there? Right? You want them to be completely broken?
You really want to be like,
I respect it because I've been there too, right? Like I've had rough months where I felt really, whatever. But I've talked to my wife about this. I've talked to my friends about this, and I've said from day one, this is going to be a hard stretch. If I have a rough time, somebody's going to need to step up for me. If somebody else has a rough time, I'm feeling strong, but I have to be positive. Right.
Yeah.
I have to try to be, I don't have my blinders on, but when I go to work, I'm like, okay, I wish I had no ICU patients right now.
Yeah.
Okay. I don't need the intellectual, whatever but I'm an ICU physician. I've got to go in there and I've got to do my thing. It's like, if you're at the front of the ship in the storm, it gets stormy. I don't want somebody panicking.
No, I mean, exactly. Right? You want your leaders, you want your physicians, you want all your care team to be sound of mind and not panicking. Amen, brother. Listen, thank you so much. Thanks for being vulnerable. Thanks for sharing. And I don't know. I think I don't know this for a fact, but I know these conversations not only help others because it recognizes the struggle, but there are people that will listen. I wouldn't be doing this if I don't think people aren't listening, and hopefully it will have some impact in our response. Because, like I said, someone needs to be advocating for those that can't advocate for themselves. So, thank you.
Stay strong, everybody. We'll get through this together.
Yeah, we're gonna get through this. Absolutely. Thanks so much, guys.